Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this session, I will be discussing a very important topic in the connective tissue disorders, that is the vasculitis. So you should know the definition of the vasculitis. As the word itself tells you, that is itis. It is the inflammation of the vessel wall. So vasculitis, right, it is a clinical scenario or it is a heterogeneous group of disorders right. It is a heterogeneous group of disorders that is characterized, right, that is characterized by inflammatory destruction of the blood vessels. Right, so that is what you will observe in the vasculitis. So these inflamed vessels, right, these inflamed blood vessels, they are liable to occlude or rupture or develop a thrombus. Right, these inflamed blood vessels, they are liable to occlude or rupture, or there will be, right, or there will be thrombus formation within the blood vessels. So because of occlusion or because of rupture or because of thrombus formation within the blood vessels, the delivery of oxygen and nutrients to the tissues will be reduced. Right, delivery of oxygen and nutrients to the tissues will be reduced. Okay, that is what you will observe in vasculitis. And this vasculitis, let me tell you, it is a multi-system disorder. Why? Because multiple vessels involvement will be there in these patients with the vasculitis. Right, so there will be multi-vessel involvement. So because it is the one with multi-vessel involvement, this vasculitis will have multi-organ dysfunction. Right, multi-organ dysfunction, multiple organs are affected, and initially the clinical features, they start with non-specific symptoms. Right, initially the individual will have the non-specific symptoms, then followed by that there will be involvement of the individual organs. So that is what is the basic introduction of your vasculitis. So it is a disorder which is the heterogeneous group of disorders that is characterized by inflammatory destruction of the blood vessels. Right, and these inflamed blood vessels are liable to occlude or rupture or develop a thrombus, and therefore they lose the ability to deliver the oxygen and nutrients to the tissues and organs, and multiple vessels are involved. That is the reason why you have multiple organs which gets affected in these patients with the vasculitis. Now if you see the vessels which are affected, they include large vessels, medium sized vessels, and as well as the small vessels. Now you need to know what you understand by this word large vessels. They include aorta and its branches. Right, aorta and its largest branches, they are the one which comes under your large vessel vasculitis. Whereas if you see this medium vessel vasculitis, it is mainly the visceral arteries and their branches which are being affected. Right, visceral arteries and its branches are being affected. And if you see this small vessel vasculitis, the vessels which are affected in small vessel vasculitis, they include arterioles, then venules, next capillaries. These are the vessels which are affected in the small vessel vasculitis. Now, you should know what are the examples of large vessel, medium vessel, and as well as the small vessel vasculitis. So you see this question, small vessel vasculitis are, right? This is how the question can be asked. Classical polyarteritis nodosa, Wegener's granulomatosis, giant cell arteritis, Henon-Schollen's purpura, and then the Church-Strauss syndrome. Now, let me give you the examples of large vessel, medium vessel, and as well as the small vessel vasculitis. So, the examples of large vessel vasculitis, they include number 1, giant cell arteritis, and next we have Takayasu arteritis. Right, so these are the examples of the large vessel vasculitis. This giant cell arteritis, this is also called as temporal arteritis. Now, you take medium vessel vasculitis. The examples of medium vessel vasculitis are polyarteritis nodosa. Then we have Kawasaki's disease. Right, and next we have another very important next to this Kawasaki, that is Berger's disease. So these are the examples of medium vessel vasculitis. Now if you observe the examples of the small vessel vasculitis, the examples of small vessel vasculitis, they include Wegener's granulomatosis, right, and then we have Henon-Schollen's purpura, and another important small vessel vasculitis is Church-Strauss syndrome, then lastly microscopic polyangiitis. Right, microscopic polyangiitis. So these are all the examples of the small vessel vasculitis. So after having discussed about what are the examples of large vessel, medium vessel, and small vessel vasculitis, let me tell you what are the features of large vessel, medium vessel, and as well as the small vessel vasculitis. So in all of these, you have in all the forms of vasculitis, you have the presence of the constitutional symptoms. Right, you have the presence of constitutional symptoms. Now these particular constitutional symptoms, they include the development of fever, next weight loss, arthritis or arthralgia, and then malaise. So these are the constitutional symptoms that you will have in these patients with the vasculitis, and you will have these constitutional symptoms in all the forms of vasculitis, large vessel, medium vessel, and small vessel vasculitis. And particularly if you take large vessel vasculitis, large vessels which are affected is your subclavian artery, which will be supplying to your upper limb, then the common iliac artery supplying to the lower limbs. So if those vessels are affected in large vessel vasculitis, the blood supply to the extremities will be reduced and the individual will have limb claudication. Right, the individual will have limb claudication. Then they will also have asymmetrical blood pressure. Right, and you will have this asymmetrical blood pressure particularly in case of Takayasu arteritis, and there can be also absence of pulse, and that is the reason why we call these as pulseless disease. There can be bruit on auscultation, right, because of the narrowing of the vessel, and there can be also aortic dilatation. Okay, so these are the features of the large vessel vasculitis. Then coming to the medium vessel vasculitis. In medium vessel vasculitis, the overall clinical manifestations, if you see, there can be presence of cutaneous nodules, right, and there will be presence of the ulcers. Next, livido reticularis, right, where you have the spiderweb appearance within the skin, and there can be digital gangrene, then followed by that there will be mononeuritis multiplex. So these are the features of the medium vessel vasculitis. Then finally, you should know what are the features of small vessel vasculitis. Features of small vessel vasculitis, definitely again you have constitutional symptoms as usual. Then the other features include the development of purpura. Next, there can be urticaria. And third, there can be vesiculobullous lesions. Right, vesiculobullous lesions. Then followed by that, there can be development of glomerulonephritis. Next, there will be development of alveolar hemorrhage. There can be uveitis, right, and there can be also splinter hemorrhages, and even ophthalmic manifestation can be there, and that ophthalmic manifestation will be in the form of episcleritis, right, and then scleritis. Okay, so these are the manifestations of small vessel involvement. Right, now after having discussed about the clinical features in vasculitis based on the vessel involvement, let me tell you, or let me just give you a brief idea about like what will be the important features of the individual vasculitis. Right, I have said you know grossly what will be the features of the large, medium and small vessel vasculitis. But for suppose if the individual develops giant cell arteritis, what will be the clinical features? They include, first and foremost, in case of the giant cell arteritis, the most common vessel which is being affected is the temporal artery. And here, females, they are more commonly affected than compared to that of males. Right? And in these individuals with the giant cell arteritis, there is one of the very important feared complication, that is irreversible blindness. Right, that is irreversible blindness. And this irreversible blindness, so the most common vessel affected is the temporal artery. That is the reason why it is called temporal arteritis. And this particular irreversible blindness is due to involvement of ophthalmic artery. So it is due to ophthalmic artery occlusion. Then there can be jaw claudication. That is also because of the involvement of the temporal artery. And if you observe the investigations in temporal arteritis, there will be elevated ESR. So these are the features of the giant cell arteritis or temporal arteritis. Next, if you see the Takayasu arteritis, right, which is also called as the pulseless disease, right, which is the example of your large vessel vasculitis. So if you observe here, it is an inflammatory arthritis, so the ESR is being elevated, right, and the vessel which is most commonly affected in Takayasu arteritis will be the subclavian artery, and the age group at which you will have this involvement of Takayasu arteritis is around 40 years. And the clinical features in these patients with the Takayasu arteritis is there will be development of decreased pulse, there can be limb claudication. Right, there can be limb claudication. And there will be also weak pulses in the upper limbs. Right, there will be also weak pulses in the upper limbs. Now, this will be the features of the large vessel vasculitis. Now, having said this, what will be the features of the medium vessel vasculitis? Right, medium vessel vasculitis, I said you three types: polyarteritis nodosa, Kawasaki disease, and as well as the Buerger's disease. Now, you take polyarteritis nodosa. In polyarteritis nodosa, there will be aneurysms of the renal artery and there will be aneurysm of the visceral abdominal branches. Right, so there will be renal artery aneurysm, or there can be visceral branches aneurysm. And this polyarteritis nodosa, it has a great association with the hepatitis B. And in these individuals with polyarteritis nodosa, you have necrotizing immune complexes. Right, you have necrotizing immune complexes. That is what you will observe in the polyarteritis nodosa. Then you see in patients with the Kawasaki disease, here also the type of inflammation that you will have is necrotizing inflammation. Right, the type of inflammation you will have is necrotizing inflammation. And coronary artery is the most common vessel which is affected in Kawasaki. So there will be coronary aneurysm. Right, there will be coronary aneurysm, and they can also have congested conjunctiva. Okay, so these are the features of the Kawasaki disease, right, where there is necrotizing inflammation, coronary artery aneurysm, and then congested conjunctiva. Then if you see the Buerger's disease, right, that is BUER, Buerger's disease, the another name of it, Buerger's disease, is it is called as thromboangiitis obliterans. Right, it is called as thromboangiitis obliterans. So this thromboangiitis obliterans, it is seen in heavy smokers. Right, it is seen in the heavy smokers, and these patients, they have the presence of Raynaud's phenomenon. Right, that is nothing but your peripheral vascular disease, and there will be also severe pain in the extremities. And then finally, these patients within the extremities, there can be also development of gangrene because of decreased blood supply to the extremities. So these are the features of your medium vessel vasculitis, like polyarteritis nodosa, Kawasaki, and as well as Buerger's. Then you see the features of the small vessel vasculitis. What are all the examples of small vessel vasculitis? Microscopic polyangiitis, Wegener's granulomatosis, Church-Strauss syndrome, and then the Henon-Schollen's purpura. Right, so these are the examples of your small vessel vasculitis. So particularly if you take microscopic polyangiitis, it is a polyimmune glomerulonephritis. Right, so you have glomerulonephritis, which is a polyimmune glomerulonephritis, and you have the presence of a palpable purpura in microscopic polyangiitis. Then followed by that, there is no granuloma formation in microscopic polyangiitis. It is necrotizing inflammation that you will have in microscopic polyangiitis, and in these patients you have the presence of the p-ANCA being positive. Right, you have the presence of the p-ANCA being positive. Then you take Wegener's granulomatosis, here the c-ANCA is positive. Right, here the c-ANCA is being positive. Then in these individuals, they have granulomas, right, and it is a granulomatous inflammation. Right, it is a granulomatous inflammation, and the structures which are affected in Wegener's granulomatosis will be involvement of lower respiratory tract, that is lung, involvement of the upper respiratory tract, and there will be also involvement of kidney, that will be in the form of hematuria. Next, you take Church-Strauss syndrome. Church-Strauss syndrome is the disorder where you have ANCA being positive. These patients, right, they have the development of asthma, right, there can be development of sinusitis, right, and there will be upper airway involvement, and next the development of palpable purpura. So these are the features of the Church-Strauss syndrome, and they also have development of peripheral neuropathy. That is what you will observe in Church-Strauss syndrome. And Henon-Schollen's purpura is another form of small vessel vasculitis, right? And this Henon-Schollen's purpura, it is characterized by a tetrad. What is that? H stands for hematuria in the Henon-Schollen's purpura. S stands for the skin lesions, and that skin lesions will be in the form of purpura. The word P stands for pain. Where exactly the pain? Pain within the joints and as well as the abdomen. Right? Pain within the joints and as well as within the abdomen. So these are the features of the small vessel vasculitis. Right? So always remember, your vasculitis, it will be a multi-system disorder. Right? It will be a multi-system involvement because multiple vessels in the body gets affected in case of the vasculitis. So if you see the question back again, small vessel vasculitis, what are the examples? Wegener's granulomatosis is a small vessel vasculitis. Henon-Schollen's purpura is a small vessel vasculitis. Church-Strauss syndrome is also an example for your small vessel vasculitis. So one way of classification of your vasculitis is based on which vessels are affected. And second important thing, how you can classify vasculitis is based on the type of inflammation. Like you see the question here, granuloma is pathological feature of all except the options are giant cell arteritis, microscopic polyangiitis, Wegener's granulomatosis, and then the Church-Strauss syndrome. So you take this granuloma formation, or where is that you have the presence of the granulomatous vasculitis. So you have this granulomatous vasculitis in patients with giant cell arteritis, right? You have that in Takayasu arteritis. Third, it is present in Wegener's granulomatosis, and fourth, you have this granulomatous vasculitis in Church-Strauss syndrome, right? Church-Strauss syndrome. So these are the conditions where you have the presence of the granulomatous vasculitis. And if you see non-granulomatous vasculitis, right, where you have necrotizing inflammation, you have that in case of the polyarteritis nodosa. Then in patients with Kawasaki's disease, right, the one which is seen in children. Next, in patients with microscopic polyangiitis, it is the necrotizing inflammation. Henon-Schollen's purpura, right, it is a necrotizing inflammation. Then essential cryoglobulinic vasculitis. Right, essential cryoglobulinic vasculitis. So this will be the examples of non-granulomatous vasculitis, right? So this is one of the classification of the vasculitis that is based on the type of inflammation. Then followed by that, if you observe, the another classification is based on the age group. See, vasculitis that is not commonly seen in adults, the options are Kawasaki, Henon-Schollen's purpura, temporal arteritis, and then polyarteritis nodosa. So vasculitis that is not commonly seen in adults will be your Kawasaki's disease. Now let me just give you the important questions. What is the most common cause of vasculitis in children? Please don't be under the impression that it is Kawasaki. No. In case of children, the most common cause of vasculitis will be Henone-Schöllen's purpura, right? Whereas if you see, the most common cause of vasculitis in adults, that will be idiopathic cutaneous vasculitis. Right, that will be idiopathic cutaneous vasculitis. That is the most common cause of vasculitis in adults. Then followed by that, the next important cause for vasculitis is the giant cell arteritis. So this is about the cause for the vasculitis in children and as well as the cause for vasculitis in adults. Then, now let me just discuss the other forms of vasculitis. What is the age groups you have? You take Henone-Schöllen's purpura. Henone-Schöllen's purpura, it is seen in children and as well as also in adults, right? Whereas if you take temporal arteritis and as well as the polyarteritis nodosa, it is the vasculitis which is seen only in adults, right? It is the vasculitis which is seen only in adults. And Kawasaki disease, right, particularly seen in children, and that too of age group less than 5 years, right? That too of age group less than 5 years. Whereas HSP, it is present in both children and as well as adults. So that is the question related to the vasculitis based on the age group at which the types of vasculitis they appear. Next. Now the other form of classification of the vasculitis is based on the ANCA, that is anti-neutrophilic cytoplasmic antibody. Where is it found? Wegener's, Church-Strauss, microscopic polyangiitis, Takayasu arteritis, and then systemic lupus erythematosus. Okay. So what is this ANCA? ANCA, it stands for anti-neutrophilic cytoplasmic antibody. Right, so that is what you mean by this word ANCA. And this particular ANCA, it is of two forms. One we have P ANCA and another like what we have is the C ANCA. So P ANCA, the word itself tells you, it is perinuclear location. Right, it is perinuclear in location. So ANCA, we have two forms. One is P ANCA and the other one is C ANCA. So if you take this P ANCA, as the word itself tells you, where is this P ANCA present? Right, it is the localization of stains on the perinuclear region. Right, so it is perinuclear localization. Right, then if you take this C ANCA, as the word itself tells you, it is cytoplasmic localization of the stain. Right, it is cytoplasmic localization of the stain, and P ANCA is perinuclear localization of the stain. Now it is an anti-neutrophilic cytoplasmic antibody. That means these antibodies will have the target antigens. Right, these antibodies, they have the target antigens. So if you take the target antigen for the P ANCA, the target antigen for the P ANCA is myeloperoxidase. Whereas the target antigen for the C ANCA, it is proteinase 3. Right, it is proteinase 3, that is PR3. Now you should know what are the conditions where you have the P ANCA and what are the conditions where you have C ANCA. So first of all, if you take this C ANCA, it is present or it is associated with Wegener's granulomatosis. right? It is associated with Wegener's granulomatosis. Whereas if you see P. ANCA, so this P. ANCA, it is present in microscopic polyangiitis and then the Church-Strauss syndrome. Now, what are the other conditions where you have this particular P. ANCA predominant vasculitis? Apart from MPA and CSS, you have this in crescentic glomerulonephritis. Right, crescentic glomerulonephritis. So this is about your classification of the vasculitis based on the ANCA, that is P. ANCA and as well as the C. ANCA. So this is a table which gives you the classification of the vasculitis based on the size of the vessel, that is large vessel vasculitis, that is temporal arteritis and Takayasu arteritis, medium vessel vasculitis, that is polyarteritis nodosa, and then Kawasaki's disease. Small vessel vasculitis, we classify that again into ANCA positive and as well as the ANCA negative vasculitis. So if you take the medium vessel vasculitis, we have polyarteritis nodosa, then we have Kawasaki disease, and the next important is Berger's disease. And if you take small vessel vasculitis, again we classify that into ANCA positive and as well as ANCA negative vasculitis. ANCA negative is your Henoch-Schönlein's purpura, essential cryoglobulinic vasculitis and cutaneous leukocytoclastic angiitis. Whereas ANCA positive are Wegener's, MPA, Church-Strauss and renal limited vasculitis, which is nothing but crescentic glomerulonephritis. Out of which the C. ANCA you have in Wegener's and P. ANCA, it is present in microscopic polyangiitis, Church-Strauss syndrome, crescentic glomerulonephritis, which is nothing but your renal limited vasculitis. Right? So this is about the classification of the vasculitis. Now, after having discussed about the classification of, and we have discussed the classification of the vasculitis based on the size of the vessel, right? Based on the type of inflammation, based on the age group, and then based on the presence of C. ANCA and as well as P. ANCA, right? And after having discussed about the classification of the vasculitis, now let me take up the discussion of the individual forms of the vasculitis.